Now it's wasting of hand, and this is a very common scenario encountering in exam, and it can come in various ways. And there is long list of DD which you should know, and usually the command is either examine the upper limb. In the exam mostly what they are saying, either examine the upper limb, either examine the lower limb, or examine cranial nerves. Like this the command can be. So this comes in the command of upper limb. Now candidates find it very difficult because there are a lot of causes written over here, and how to differentiate and how to diagnose and how to proceed. So but I don't feel that it's much difficult. As I always say, if you follow your scheme, don't omit any step of upper limb examination scheme, you will come to the diagnosis. Okay, like in upper limb examination, if you get, first thing is inspection. So if you on inspection, as I am explaining in with every topic, when I am daily explaining every topic, I am telling you the points to be noted on inspection with every disease. So inspection is very important, don't omit this step. In this case you can find wasting of hands, which is very important clue. Okay, so then you have to think of wasting, the causes for the wasting of upper limbs, and along with that you can find any other clue as well. Okay, so that will help you to reach the diagnosis. Then comes the motor system. Examine the motor system fully. Okay, and decide whether it is lower motor neuron type of lesion in the upper limb, or like if patient is having hyporeflexia, hypotonia, and some there are other signs related with every specific disease, and decide whether it's upper motor neuron type of lesion in the upper limb, like if patient is having hyperreflexia, hypertonia, and some other signs related with every disease. Okay, so or there is no lower motor neuron, no upper motor neuron, this is normal upper limb, so then we will think of other things. But first, okay, so this you have to decide on motor system. See, first thing is inspection, then motor system, decide it is lower motor neuron type of lesion in the upper limb, or it is upper motor neuron type of lesion. This lesion is present in the one arm, or this is present in both arms, decide it. Okay, then comes the sensory system. This is very important, and in most of the cases actually diagnosis is made on the basis of sensory system. You have to decide whether which type of sensation is involved, whether dorsal column is involved. Okay, what could be the reasons for dorsal column? If it is glove and stocking pattern, okay, what could be the reasons for glove and stocking pattern? And if it is any dermatomal involvement, okay, what are the reasons for dermatomal involvement? I will tell you all the causes about it. And if there is no sensory system involvement, okay, what could be the cause? Okay, so like this you have to think, and then you have to do the relevant. So first I will explain you, if you find lower motor neuron type of lesion in the upper, and okay, so this is sensory system, and this is I am telling you the scheme for the upper limb. Okay, inspection, motor system, sensory system, then comes the cerebellar system. Okay, so examine the upper limb for the cerebellar signs as well, and then comes the gait, or the relevant with each disease which you are thinking, your differential. So first I will explain. So if you will follow all of these steps, you will not miss the diagnosis. Okay, or at least you will be able to give a very good differential. Okay, and you can get good marks. So first I will tell you, if you get lower motor neuron type of lesion in the upper limb, so what could be the causes? First of all, you got on the motor system lower motor neuron type of lesion, decide whether it's in only one hand or it's in the both hands. Okay, and then inspection, and now comes the sensory system. Now if you found out that sensation is normal, there is no problem with the sensation. So then you can think of there are some causes which you can think of, and it could be either anterior horn cell disease, which is motor neuron disease. It could be motor neuropathy, myotonia dystrophica, disuse atrophy, and cachexia. Either of this can be if sensation is normal. Okay, so please remember all of these differentials. Now you have to do the relevant of each cause, so each differential, so that you will come to your diagnosis. Like if sensation is normal, and so you should examine the tongue for fasciculations for the motor neuron disease. You can examine the eyes as well, you can examine the lower limbs as well quickly for evidence of spastic paraparesis. Okay, this is relevant. I have explained in detail what relevant you need to do when daily I am explaining every topic or every disease. Okay, so here I will tell you only briefly. So and then you can do the percussion myotonia to see myotonia dystrophica, but in this case you can on inspection you can find the ptosis as well. Okay, so while on disuse atrophy or cachexia, on the disuse atrophy everything will be normal except you can find rheumatoid hand, so you can give a good differential. Okay, so clear up to here? Like if sensation is normal, what are differentials and what relevant quickly you need to do. Okay, now if this I was talking about lower motor neuron. Now again, if you found lower motor neuron type of lesion and you found a dissociative sensory loss, like pain and temperature sensation is impaired, so you should think of syringomyelia, and you will do all the relevant, you will look for all the relevant signs of syringomyelia. Okay, this I will teach you after I think tomorrow or after 2 days. Then I will tell you in detail what relevant you need to see. But quickly you can examine the lower limb for spastic paraparesis, and you can examine the eyes for Horner syndrome and for INO. Okay, so again, if you found lower motor neuron type of lesion, and on examination of the sensory system, it is the sensory disturbance is in glove distribution, so you should think of polyneuropathy and or hereditary motor and sensory neuropathy. Okay, and for that you will do the relevant, as I have explained in hereditary motor sensory neuropathy and as well as in polyneuropathy as well, what relevance you need to do. You can examine the lower limbs for any stalking pattern of sensory loss, and you can examine the eyes, look for pallor, you can examine the tongue. Okay, and you can find feature of any underlying disease. This I have explained you in detail. Okay, so if you found lower motor neuron type of lesion and there is dorsal column involvement, like dorsal column sensation like vibration and proprioception is lost, so you should think of Friedreich ataxia, and you can get the cerebellar signs as well. Then your diagnosis should be very clear, and then you can see the relevant of Friedreich ataxia like pes cavus, high arched palate, kyphosis and other things relating to Friedreich ataxia. So this was this I told you, lower motor neuron lesion, along with how which type of sensation is affected and how you can make the differential and diagnosis. Now I will tell you it's lower motor neuron type of lesion, and if there is dermatomal sensory loss like C8 to T1, then what differential you should think. Okay, there are 5 causes: Pankos tumor, neurofibroma, cervical myelopathy, cervical rib and brachial plexopathy. This I will tell you brachial plexopathy in the end. So now if you found C8 T1 sensory loss, these 5 differential you should think, and then you will do the relevant of each cause. Like quickly what you can do, you can palpate the supraclavicular fossa for cervical rib, and you can on inspection you can find evidence of neurofibroma. You can look for hearing aid, capillate spot. For neurofibroma I am talking. And you can auscultate the chest for Pankos tumor, and you can see the signs for cervical myelopathy, like any neck collar you can observe, or you can find spastic paraparesis in the lower limb. Okay, so clear? Like this was lower motor neuron type of lesion with C8 to T1 sensory loss, I told you. Except in cervical myelopathy it will depend like where is the sensory loss. It could be anywhere like C5 to 7, C8 to T1, it will depend upon, but it will be dermatomal sensory loss. So, and if you found sensory loss, again if it is lower motor neuron type of lesion and you found sensory loss in median or ulnar nerve distribution, then it is clear that it is median or ulnar nerve palsy. Okay, so the features of median and ulnar nerve palsy I will tell you when I will come to those, so just keep in mind. So I hope it should not be difficult for you now, and you can make your diagnosis. Don't be confused, don't shatter your mind, be very confident, and whatever you find, make diagnosis on the basis of those signs. Okay, and give a list of differential, and then you can tell my most likely diagnosis is this. So in this way you have to explain. Now one term I use, brachial plexopathy. I heard sometime 2-3 times I heard that it also appeared in the exam. What happened in that, there is it's unilateral and there is severe pain in arm, and there is lower motor neuron type of lesion, but there is no backache, no neck ache, and there is dermatomal sensory loss. Okay, so this is brachial plexopathy. And other is radiculopathy. This I am telling you just for the theoretical purpose. In this patient is having backache, neck ache, and it is bilateral, and there can be dermatomal sensory loss. So one thing I want to tell you, like if you found upper motor neuron type of lesion in the upper limb, so what you should think. If it is unilateral, it could be stroke. If it is bilateral, even then it could be stroke. And you can think of motor neuron disease, which is anterior horn cell disease, because anterior horn cell disease, I told you that there are different patterns for it. It could be lower motor neuron type of involvement, upper motor neuron type of involvement, and mixed pattern. So you have to think of this disease when you get upper motor neuron type of weakness. And cervical myelopathy, when it involves C1 to C4, Parkinson's disease, and Friedreich ataxia. Okay, so this you will think when you found upper motor neuron type of signs in the upper limb. So okay, is it clear up till now? If any question you can ask. So just follow your scheme, don't omit any step. Okay, from starting to end you will get your diagnosis, or at least you can get a good differential, like inspection, motor system, sensory system, cerebellar signs, percussion myotonia. Okay, please like, share and subscribe my YouTube channel for more videos. Thank you.